to just rotate as far as I can to the left. And the second thing that I need is for you to not expect it. Here we go. How is that?
That was a little bit scary, but...
First neck adjustment ever. Good job.
No, I like that you didn't tell me or else I would have been scared.
Oh, believe me, it's not my first rodeo. From that position. It was easier the second time,
It was definitely easier, yeah.
Good.
It feels good though, I actually like it.
It usually does, which is, I mean, if it felt terrible, I don't think people would come back, right? So. Hi, Mia. Good to see you again today. So Mia is she's been in the shadow a few times. She's a recent graduate, and she's looking at becoming a chiropractor herself, learning more about the profession, and getting treated as well. So she said she's got some stiffnesses that she's been dealing with. I'm going to let her kind of walk us through them. So Mia, why don't you tell us a little bit about yourself?
Yes. Okay, so I'm a recent Queen's University graduate. And a former athlete. I've played competitive volleyball for about 8 years, and I've always had stiffness in my lower extremities, particularly my ankles, my calves and quads, and even in my upper back because I do tend to sit a lot now.
Okay.
Especially in school for 4 years when school was online and then in person,
yeah.
Sitting in the library for hours and hours, and I'm also looking at becoming a chiro one day too. So I really just want to kind of get adjusted, see how it feels, and yeah.
You're in the right place if that's the case, right? So you're a recent grad, and obviously when you were, you're still in school or you graduated then?
I graduate this April.
This coming April.
This coming April.
Okay, my bad. So she hasn't graduated yet.
Yes,
because
very
that was
close.
going to be my question. You were saying that you do a lot of sitting, but I thought you had graduated, so I was like, what job do you have that mandates a lot of sitting, or what is it that you do in your day-to-day? Is it predominantly studying still then?
Right, so I'm still taking 2 online courses, and I moved home because I only have 2 left.
Yeah, might as well.
Yes, and then job, I also work at F45 training.
Okay, so you're a personal trainer.
Yes.
Nice.
So I've been a personal trainer there, and I love it. And
are you the one who's yelling at the people?
Oh yes, I'm
move your asses!
Okay. Don't tell more jumping jacks.
You're a cheerleader. Okay.
I'm the cheerleader, absolutely.
All right. Yeah, I got some friends who've done F45, and if you guys don't know what that is, you should look it up. Do they have F45 in the States?
Yes.
That's where most of my viewers are from. So
yes.
It's exhausting. Go try it. I dare you. Okay, so F45 trainer, and then you combine that with the prolonged hours of studying then, right? Okay.
Yes.
Yeah, so it's a very common combination that I see with a lot of the younger patient base that comes in here. Obviously, they're studying, they have their academic aspirations, but they're active, right? And sometimes when you jump between these two extremes, that can result in these feelings of, well, we're talking about stiffness, but I'm going to say unpreparedness if you don't take the time to kind of do that mobility work and stretch out in between, or you just don't kind of care for your musculoskeletal system as much because it's not really a priority. How you're early 20s then?
Yeah,
you're 22, right? And that's not, this is kind of where you're just starting to enter that point of your life where you would benefit from some kind of regular massage or physio or chiro or osteo, because up until now you've been made of rubber, and you probably still are made of rubber to a degree, but we're going to slowly make that transition now. So yeah, you're saying stiffnesses. Where are you feeling those exactly? I think I kind of put the words in your mouth, but tell us about that.
Right. So currently I run outside with my dog, so I feel stiffness more in lower, more in the quads. Also calves, ankles, and honestly kind of everywhere. I'm not gonna lie. I don't really have a specific location.
Top of neck all the way down to all the way down to the calves even. Okay.
So everywhere.
Have you seen not a chiro, but have you gotten regular massage or physio before? No? Okay, so never before. All right. So that could explain why, right? I mean, you can do all the mobility work in the world, but sometimes you just need somebody else to put an elbow in there. Okay, so are there any other concerns, or is that pretty much summarizes it for you?
I think that
summarizes it. Perfect. Okay, so with that said, what we're going to do is we'll get into a physical exam, okay, and then after that, we'll find what would, in my opinion, be the most effective way to kind of deal with these things, okay?
Okay.
Awesome. Mia was saying that she's getting stiffnesses pretty much everywhere, including down to the lower limbs, so it makes sense then to do range of motion exams through all of those regions, right? So let's start at the top and work our way down. Actually, do you have someone to tie your hair up with there by chance?
I actually
That's
don't.
okay. I come prepared, so here
Thank
you are,
so
right there.
much.
Perfect.
Thank
All right,
you.
don't mind tying the hair up,
Yes,
and then
of
we'll do
course.
the range of motion exam. give you a second there. That's a lot of happy faces on your bracelet.
Oh, thank you.
Yeah.
I know, I'm like obsessed with this designer.
Interesting. Okay. So from this position, I'm going to get you to bring your chin down to your chest for me. Are we getting any pulling, any kind of tight sensation back here as we do that? No? What if I come back here and I push the head further down? That's still okay?
Mm-hmm.
Okay, come back up, look towards the ceiling for me. Any discomfort back there as you do that? No? Okay, and once again, I'm going to take this, pull it further. Still okay?
Mm-hmm.
Love it. All right, face forward. I need you to rotate as far as you can to the right. Good, so we can get to a full 85, 90 degrees. Now as far as you can to the left, please. So we can get to about 70 degrees. There's a little bit of a decrease on the left side as compared to the right. It's not huge, but it's there. I'll get you to bring the right ear down to your right shoulder. We can get to about 55 and left to left. And 45. So again, we're a little bit decreased on both left lateral flexion and rotation as compared to the right. It's normal to have these asymmetries, but it is suggestive of some kind of reduction, or excuse me, some kind of stiffness or tightness. Feeling down through these traps, they both feel quite tight to me. Does one feel more tender than the other as I press in through this region to you there, Mia?
I would say a little bit to the right.
A little bit to the right?
Yeah.
Okay. That would make sense to me. Again, to my hands, they feel very, very similar, but with reductions in left-sided movements, that could potentially be explained by increased stiffness through the right side because it doesn't want to release as much as compared to the left, hence her being able to turn further to the right. That makes sense. All right, I'll get you to give yourself a tight hug, please. You're good. And from this position, I'm going to get you to rotate, rotate, rotate. So we don't have that much thoracic rotation here. We can maybe get about 30 degrees to the left. Now let's go as far as we can to the right. We can actually get a lot more rotation to the right. We can get to the full 45. So there's a decrease to the left. I'll get you to relax those hands now. Please stand up for me. And I'll get you to bend down, touch your toes for me, please. Any discomfort in the low back or the hamstrings or anything with that?
No.
No? Awesome. I'll get you to come back up the other way, please, and extend backwards for me, just like that. Any discomfort in the low back with that?
Like here a little bit.
All right, so she's pointing to the base of her sacrum region, very common area to be having some discomfort with extension. You can stand back up. Good. Have a seat for me. All right, once again, bring those arms up for me. Okay. And I want you to fight me. Don't let me move them. Fight, fight. Good. Fight, fight. Good. Bring your arms forward. Curl the wrists backward, please. Perfect. Keep them there. Strong. Good. 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 Turn over. Curl wrists inward. Nice. Stronger. There we go. Knee have it. Fingers curled. Keep them strong. Keep them strong. Good. Good. Grr. There we go. There it is. And turn over. Fingers straight. Please gently squeeze my fingers. I have to say gentle because one person nearly broke my hands. And
really?
Yeah. I don't know if he was trying to show off or anything, but it's not very impressive. Just relax the arm as best you can there. Good. Good. Bring this arm up. Drop, drop, drop. Let me hold it. That's not letting me hold it.
Okay.
There you go. Relax. Good. There we go. There we go. And I'll do the same on the other side. And relax as best you can. Good. And drop, drop, drop the arm. There we go. Perfect. Normal upper limb neuro. I'll get you to push this leg up into my hand as hard as you can, please. Good. Push this leg up as hard as you can, please. Good. Lift the toe up. Good. Lift the toe up as hard as you can, please. Nice. Okay. Relax the legs. Relax the legs. No, actually, yeah, I get it. Mia's got some long femurs, so we need to actually get her to shift back because my table is quite low because I got short femurs. So there's a little kick. Missed. So very slight. Here, I want you to actually do this for me. Take your fingers and pull, pull, pull as hard as you can, as hard as you can. Little bit, very mild reflexes there. Drop this. Good. That one's better. Good. Good. Awesome. Okay. So, I'll just sit right here while I explain this. So, Mia was asking me why it is I like to do this on my patients, and every physical exam should include an observation of the actual patient, the way they stand, the way that they move, range of motion examination, a neurological examination, palpation, actually putting the hands on the patient to feel through yourself, as well as orthopedic examination tests, which I include in most of my videos here. Not every patient condition necessarily warrants a full neurological examination, but I'm a huge fan of doing them on all of my patients regardless, just for screening purposes. That's kind of a personal thing with family history of neurological disorder. I like to be a screening person for potential neurological dysfunction. Now, yeah, Mia's reflexes are good up here. They're a little bit decreased down here, but that's not necessarily concerning. It's still something that I'd want to do and show that I do, because hey, it's important that we be proactive about these things and screen for them whenever possible. So, does that answer your question there?
Yes.
She did ask that off camera. So, Mia was getting a little bit of discomfort here. You can just relax that leg for me. When we were extending backwards into that lumbar extension, primarily at the SI base. So we're going to do a full lower limb orthopedic screening too. Not expecting to find anything that is quote unquote wrong aside from that SI region. Perhaps it might be tender, it might be tight, because again, she's young, she's active, she's fit, so I'm not too worried about that. But let's get started with it. Straight leg raise, we're going to bring this all the way up. Do you get any back discomfort with this at all? No? Anything zigging down the back of the leg at all? No. We do get some kind of tightness, probably limited by hamstring there, right? Yeah. Totally normal. I'll get you to slowly lower that leg down yourself now. Any discomfort in the low back as you do that?
No.
No? Awesome. Okay, we're going to do same deal. Other side, we're going to bring this leg straight up as far as it'll go. Any discomfort at all in the low back as I do this?
Low back, no.
No? Perfect. Just the hamstring again?
Yes.
Perfect. Slowly lower down yourself. So we do have some tightness of those hamstrings. We can do some PNF stretching of them later if we want to try to open them up a bit more, for sure. Okay, I'm going to bring this up. Now, sorry, when you were extending backward, all right, if you can recall, was there more discomfort on one side versus the other, or was it pretty smack in the middle?
I think it was pretty smack in the middle.
Pretty smack in the middle, okay. So we're going to bend the knee. I'm going to place my hand behind your hip here. I'm going to push on through. That okay? Mm-hmm. Good. You can do the same deal on the other side. Oh, thank you for helping. Mm-hmm. Is that okay?
Yeah, it's just tight on my, here.
So you are getting some more tightness as I press in through that side,
yeah?
Okay. Let's do a hip strain. I'm going to take this. We're going to bring you all the way up in flexion. That's full. Bring you here. Rotate, rotate. Good internal rotation. Let's do the external. Is that okay? Or
it's definitely sore.
It's sore again, same spot in the back there.
No, it's like sore here.
Oh, in the adductors.
Yeah.
Okay. Did you have a workout kind of recently or not really?
I just ran this morning.
You just ran this morning. That'll do it. Absolutely. I'm gonna move this because I think your knee's gonna hit it as we do this. So I'm gonna bring this all the way up. How far did you run?
Today was 8.5.
That's impressive. That's more than I've ever run. Actually, no, I think I did a 10K once. So you definitely have more internal rotation on this side.
Okay.
As compared to the other side. Like here, we're almost able to get to a full 90, so that's maybe 80 degrees. On the other, we got to 45, so, and that's okay too?
Yeah.
Okay. So, are you left or right leg dominant? Like if you were going to kick a soccer ball as hard as you could, you kick with your right leg. Right. Interesting that the left leg dominance is the one that's less mobile. Huh, you don't see that very often. Let's get you to go face down next, okay? My hands are going to go on your back, okay? I think I said that already.
Yeah,
Let's
yeah.
go. All right, so brief anatomy overview for those of you watching. Spine, most people get that part right. Bottom of the spine is the sacrum, okay? It's that triangular shaped bone. The sacrum connects into the iliums, okay, which are our hip bones proper, I guess, creating the sacroiliac joint between the two of them located right around here, okay? So I'm going to press on through the SI joint here, press on the left. Is that okay as I press through there? Because that feels tight to me.
It does.
What do you feel?
It feels tight.
Okay. Let's compare that to right, which actually doesn't feel too great either. But what do you, no, you tell me, because what I feel is different from you.
That feels better, to be honest.
That feels better for you?
Yeah.
Okay. So, to me, the left side has less give than the right, but they're both a little bit locked, so I'll be moving them both today. Let's look at what else we got. Okay. And you mentioned, with the studying that you do, upper back stiffness is a usual thing for you, yeah?
Yes.
Okay. Ooh. So feeling through the thoracic paraspinals also includes feeling through the rib heads too, because remember up here we obviously have our rib cage. That is where the costals, the ribs, will connect into the vertebrae or the spine bones, creating the costovertebral joints, which are quite often stingers and also tight in cases of upper back tightness. So. So while I do have you in this position, Mia, I am going to adjust through your upper back, okay?
Okay.
So you haven't had your upper back adjusted before, have you?
No.
No? All right, first time. Let's see what we can do. So what I need from you is I'm going to get you to take a big breath in.
Okay.
And then you're going to exhale like fast for me, okay?
Okay.
So let's do it now. Just take a big breath in, all the way out. Nice. Good. That okay?
Mm-hmm.
Good. All right, there's the one. Let's try this one here. Oh, my shoulder's going to get right in the way if I do it like that. I'll do it like this. Breath in. And all the way out. Okay. One more breath in. All the way out. Okay, so it was really only that first bit, but that's okay. What's over here? Big breath in, all the way out. That one doesn't want to move at all. We'll try one more right here, but I think that might be all we're going to be able to move, at least for today up there. Let's see. Big breath in, all the way out. Yeah, okay.
Am I very tight? Probably.
Just a lot, yeah. I'm happy we were able to get this because this is where I feel most of the tension. But one thing I'm also noticing is the shoulder blades here, we get a little bit of rounding that makes it difficult to take a contact in the spine itself.
Okay.
If I were a better chiro, I could probably get it. But unfortunately, I'm having a bit of challenge here. So we're going to have to this is a case where I'd want to see you again sometime soonish, if that we could fit that into your schedule, to try moving it once more.
Okay.
But I'm not too concerned. So when I adjust somebody and something doesn't go, it's never like, oh, it's not gonna know. We still got movement in through the thing. And I know that sound and the cracking and the popping is so satisfying, and it's what brings people to watch these things on YouTube, and it's what makes patients think that they're getting better. But there are patients, like if you get the cavitation, which is the actual word for that sound, it makes no difference between getting one and the movement itself. The movement of the joint, which we'll get regardless, is the thing that results in the healing, is the thing that results in opening up the joint capsule and turning on the mechanoreceptors to inhibit pains and stuff like that. So that's why I'm never too like upset about it, even though obviously it's a bit disappointing. You want that, you know, especially if you got a microphone up close. Yeah. All right. Okay. So what you need to do is drop this, drop the head. Let me hold you. Perfect. So if we recall, Mia was having some difficulty, or rather she had some asymmetry, rotating and laterally tilting to the left as compared to the right, which would which would suggest tightness on the right side. So how does it feel as I press in through?
It's definitely sore.
Yeah, that's tender for you. Okay. Well, good news. We happen to specialize in right sides. So. Now, as I do this, do you get any kind of recreation or referral of pain up into the scalp, or not really?
Not really.
Perfect. Okay. So silly me, placed the microphone on the left side, even though I knew that the right side was going to be of more import. So I'll go ahead and switch that over here. Give me a second. There we go. All right. So in order for someone's neck to go, I need two things from them. Okay. The first thing that I need is for them to just rotate as far as they can to the left. And the second thing that I need is for you to not expect it. Here we go. How is that?
That was a little bit scary, but
You're okay. You're still here. First neck adjustment ever. You handled it like a champ. Good job.
No, I like that you didn't tell me, or else I would have been scared.
Oh, believe me, it's not my first rodeo. Yeah. Good stuff. So we got a lot of release in through that neck region. I actually hit something back here. That was what that noise was afterwards, but that's okay. Let's check out the left side now, okay? Think you can do it one more time?
Yes.
Awesome. Drop the head. Good. And so if you do end up getting accepted to chiro school, this is going to be a very common day occurrence for you, FYI.
Okay.
Yeah. Problem is when you're learning, because we all learn on each other before we work on patients, obviously, right? Nobody's going to know how to do it correctly. You're never going to have more headaches in your life than when you guys are learning how to adjust necks, just an FYI.
That's funny.
Don't be scared. It's normal. If I can do it, so can you. Drop the head, relax, good. I was talking about it and you were tensing everything
I know, I'm sorry.
No, you have nothing to be sorry for. That's my own lapse of judgment. Okay, so definitely a little bit lower down on that left side, but it's not as bad as the right. So once again, I'm going to get you to turn as far as you can to the right, and pretend my hand is a pillow. I want you to turn, perfect. So again, as she relaxes the head, as she drops it into my hand, you'll see that her SCM turns off. So again, pillow, pretend it's a pillow. Just absolutely, I love that. I love being able to see that. That's good. So from that position, it was easier the second time.
It was
right?
definitely easier, yeah.
Good.
It feels good though, actually. Good.
It usually does, which is, I mean, if it felt terrible, I don't think people would come back, right? So, yeah, if it felt as alarming as it looks. Good job.
Thanks.
As we found during the orthopedic exam, Mia's got a decrease in kind of her hamstring flexibility. She's not able to get that leg quite up to 80 or 90 degrees, which is the normal range of motion for this. So what we are going to do is we're going to do something called PNF stretching, which I've done several times on this channel. I think it stands for proprioceptive neuromuscular facilitation. I don't know, long, drawn out, doesn't really matter. What matters is what do we actually do for it to happen, and does it work? So first things first, I'm going to bring Mia's leg back up to as high as it once was. Okay, so about 70 degrees here. Yeah, that's about as far as we're going. I'm going to lock my shoulder in here. Now, Mia, what I want you to do here is I want you to drive your foot or drive your leg into my shoulder as hard as you can. Okay, for 10 seconds. Hard as you can, go ahead. You can even grip the sides of the table if you need to. Be mindful of the microphone there. Good.
Okay.
And drive, 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Good. Relax. And then, on that relaxing, we find she's suddenly able to have a lot more pliability in that hamstring. Okay? So once again, drive as hard as you can, 10 seconds. 4, 3, 2, 1. Good, relax. And once again, drive as hard as you can, drive. 6, 5, 4, 3, 2, 1, relax. Good. So after just a couple of those, or a few of those, we're able to get up to the full 90 degrees, actually even a little bit past that. So you do have good range of motion flexibility available to you. We just got to make sure we work on stretching out those hamstrings to maintain it. Now we're going to do that same thing on the other side. Okay? So here, we're going to bring this leg up. I think this leg was a little, yeah, this one didn't go as far. Right there. Once again, I want you to drive as hard as you can, 10 seconds. 1, relax. Good, and once again, drive as hard as you can, 10 seconds. 5, 4, 3, 2, 1. Good, relax. And once again, drive as hard as you can, 10 seconds. 8, 7, 6, 5, 4, 3, 2, and 1. Relax. Good, so same deal. We can get this up past 90, just a little bit of targeted stretching. That's really good. All right. Oh, you can relax. You can lower it back down. There we go. Good stuff. Awesome job. Now, if we recall, it was that left SI joint where we were getting more tenderness as compared to the right, even though, to my hands, they both felt quite stiff. So you're almost in the right position here. What I'm going to do is I'm going to just pull you closer to me. Come closer. Nice. I'm going to take this, hold right there, and good. Your head's still on the thing. Bottom leg straight. Top one's going to be bent. And then please scooch the hips towards the edge over here. Okay, come. Nice. Awesome. So from this position, I'm going to actually just move the camera a wee little bit. There we go. From this position, I'm going to get you to take a big breath in for me. And same deal all the way out fast. Good. Relax. Whew. That was pretty clunky, eh?
Yeah.
Well done. How did that feel? Was that okay?
It was good.
Perfect. Love it. We'll get you to flip over to the other side, okay? I'm going to bring this leg up. Good. Scooch again close to the side for me. Thank you. Hips towards, please. Thank you. And just going to hold right there. Perfect. Once again, breath in. All the way out. And sink. Love it. Well done.
Thank you.
So Mia was having quite a bit of tightness. I'm actually going to tilt the camera just a little bit more here up in those thoracic paraspinals there. So that's what we're going to be working on predominantly, but also hitting some of the lumbars just while we are working here. Now, Mia, as we do this part of the treatment, I usually like to ask the patient a question about themselves just to give the audience a chance to connect with them. So my question for you for today is going to be to tell us something about your job. I know you said you're a personal trainer at F45, but tell us something about your job that you find to be quite rewarding for yourself.
Okay, I think the most rewarding thing about my job is just having clients like genuinely want to improve their health and their like fitness, and being very like passionate and excited to come in and reach their goals. It's so exciting when clients reach their like PR or their weight loss goals, or even our challenges if they like win a challenge. So just seeing clients be so passionate and excited about their own like health and fitness is really it's really inspiring as a coach.
And then helping them to reach that, obviously, right?
Of course,
yeah,
yes.
Yeah. I feel a very similar way working here at Primal as well as my own little clinic. Like when a patient, the clients to you, patient to me comes in and they have their concerns, there are things that they can't do because they're in pain or they're, overweight, or there's some kind of physical obstacle in the way that they're unable to surmount, and then you're able to help them through that because ultimately it's them who's like making the effort to reach that goal, and then they reach it. It is an incredibly rewarding experience, right? So I think you specifically answering like that, if you do become a chiropractor, I think you're going to find the job just as rewarding, perhaps in a different avenue, a different way. But yeah, it's a really good answer. Thank you.
Thank you. Oh, I should have told you this, but I burnt my spine. I don't know if you could tell.
A little bit kind of dead
Yes.
center here, eh?
Yeah, I burnt it in a sauna.
Nice.
Yeah.
Okay.
I should have mentioned that.
I was going to ask how you burned a specific location there,
Yeah.
but I assumed it was just on vacation. But
No,
yeah.
it was actually in a sauna.
I'm trying my hardest to avoid that spot.
No,
so
it's okay.
All the same, it doesn't look like you wouldn't want to do this on an open burn or one that was fresh, but that looks like it's mostly healed up.
Yeah,
so I'm
I
not
hope
too
so.
worried. No, it is. It's healing nicely. Be careful in saunas.
I know. Oh my god.
Mia, how did you find all of that?
It was good.
Good.
It was a new experience.
Yeah.
But it felt so good.
Happy to hear that.
Yes,
Yeah.
everything was good.
Was there anything you like? Oh, sorry, I'll let you just keep talking.
No.
Shut up. You go ahead.
I realized like how like tense my muscles were, how
Mhm.
sore I actually was. I stretch, but I don't like ever get massages or like get like treated. So I realized how tight I am and how much more I need to stretch. But no, it felt really good. Thank
I'm
you.
glad you enjoyed. What did you think of the neck adjusting specifically? Because that was your first time.
That was a shock. The first time when he did it, I was like, no, expecting that. But then it felt so good. So like when he did it again, like it wasn't like scary because I knew you weren't.
You were quite like relaxed on that second time actually, which is really good. So no, I'm really happy with the way everything went. We talked about this a little bit off camera, like as far as like frequency of treatments. Right now, frequency of treatments for chiropractic visits will differ depending on the practitioner you talk to. My analogy here, like you're healthy, okay? There's nothing explicitly wrong with you, and not implicitly either, I hope. And you got some tightness that's associated with being a student and being a trainer. Okay, it's just part of growing up, part of getting older, right? So truthfully, starting you off out once a week just to get the stiffnesses down, and then extending those frequencies for as long as possible so that you're not in here every single week. Every patient, the end goal should be to see your doctors as infrequently as possible, right? So I stand by that. We'll talk more about that off camera if that's something you want to explore, as well as something for that hip. I forgot about the hip. We'll talk about that off camera too. Do you have any other questions for me for now, or is that no?
I think that's it.
All right. So you say you had a good experience. I'm happy to hear that. All right.
Thank you for having
Wishing
me.
you all the best in your healthcare journeys, and I'll see you again soon. I'm sure.
Thank you so
Take
much.
care.
And don't forget to like, comment, and subscribe.
Thank you, Mia.